relaxation technique skills. We all face stressful situations throughout our life, ranging from the minor annoyances like a traffic jam to more serious worries such as a loved or one's grief illness. No matter that the cause, stress floods for your bodies with a hormone, your heart pounds, your breathing speed up, and your muscles tense. It is a called stress response. It's a normal reaction to threatening situation in our prehistory to help us survive threats like as an animal attack or a flood. Today, we rarely face these physical dangers, but challenging situations in daily life can set off the stress response. We can avoid all sorts of stress in our life, nor all we want to, but we can develop healthier way of responding to them. One way is to invoke the relaxation response through a technique first developed in 1970 at the Harvard Medical School by cardiologist Dr. Herbert Benson, editor of the Harvard Medical School's special health report. That means that stress management a push for preventing and reducing stress. The relaxation response is the opposite of the stress response. It is a sense of a profound rest that can be in many ways. With regular practice, you create as well or come to deep into the needs arises. Following are 6 relaxation techniques that can help you evoke the relaxation response and reduce stress. First is a breath focus. It is a simple, powerful technique. You take long, slow, deep breath, also known as abnormal or belly breathing. As you breathe, you gently release your mind from distracting thought and sensation. Breath focus can be especially helpful for people with eating disorder to help them focus on their bodies in more positive ways. However, this technique may not be appropriate for those with a heart problem that makes breathing difficult, such as respiratory ailment or heart failure. Second, body scan. This technique breath focus with progressive muscle relaxation. After a few minutes of deep breathing, you can focus on one part of your body or group of muscle at a time and mentally releasing any physical tension you feel there. A body can help boost your awareness of the mind and body connection. If you have had a recent surgery that affect your body image or other difficult with your body image, this technique may be less helpful for you. Third relaxation technique is a guided imagery. For this technique, you conjure up certain scenes, place, or experience in your mind to help you relax and focus. You can find free apps and online recording of calm scene, such as make sure to choose imagery you will find soothing and that have personal significance. Guides imageries may help you reinforce a positive vision of yourself, but it can be difficult for those who have a intrusive thought or find it hard to conjure up mental image. Mindfulness meditation. This practice involves sitting comfortably, focusing on your breathing and bringing your mind attention to the present moment without drifting into concern about the past or the future. This form of meditation has enjoyed increasing popularity in recent years. Research suggests it may be helpful for the people with anxiety, depression, and pain. What is your yoga, Tai Chi, and Qigong? These three essence art combines rhythm breathing with a series or postures of flowing movement. The physical aspect of this practice offer mental focus that can help distract you from facing thoughts. They can also enhance your flexibility and balance. But if you are not normally active, have a health problem, or a painful or disabling condition, this relaxation might be too challenging. Check with your doctor before starting them. And the other is repetitive prayers. For this technique, you silently repeat a short prayer or phrase from a prayer while practicing breath focus. This method may be especially appealing if religion or spirituality meaningful to you, rather than choose just one technique. Experts recommend sampling several to see which one works best for you. Try to practice for at least 20 minutes a day, although even just a few minutes can help. But the longest and the more often you practice the relaxation technique, the greater the benefit and the more you can reduce the stress. What are different type of relaxation technique? Listed below are some of the different type of relaxation technique. First is progressive relaxation, also called progressive muscle relaxation. This technique involves tense different muscles in your body and then releasing the tension. Automatic training. Through a series of mental exercise involve relaxation and ideas you suggest to yourself. This means auto-suggestion. Your minds focus on your body's experience of a relaxation. Guys, imageries of visualization is guide imageries you picture object, scenes or event that are associated with relaxation or calmness and attempt to produce a similar feeling in your body. Biofeedback is relaxation to the feedback that is usually provided by an electronic device. You learn how to recognize and manage how your body responds. The electronic device lets you see how your heart rate, blood pressure, or muscle tension change in response to the feelings, to feeling stressed or relaxed. And the other way is the other relaxation technique is self-hypnosis. In self-hypnosis program, people learn to produce the relaxation response when prompted by a piece of the non-verbal cues called a suggestion or their own. The other way is a breathing exercise. For the breathing exercise, you may focus on taking slow, deep breathing, also called diaphragmatic breathing. Other complementary health practice such as a massage therapy, meditation, yoga, and Tai Chi can produce several beneficial effects in the body, include the relaxation response. However, these practices are not discussed in the fact sheets. For more detailed information on this practice, can relaxation techniques help during labor? For these techniques, the other question is, can relaxation technique help during labor and childbirth? Many women would like to use non-drug option for pain relief during labor and childbirth. In 2018, review include 5 studies, total 1,248 participants that use various relaxation technique and measure women's pain intensity during labor. Overall, the study found that relaxation techniques might help women manage labor pain, but the quality of the research varies between low and very low. Also, because different relaxation techniques were used, it's hard to say which specific technique might help. In 2019, a review compared women's view and experience of using pain medicine. That means epidurals, points, and non-drug method. Relaxation massage, non-drug method, that means relaxation or massage for pain relief option during labor and childbirth. A study, 99 women looked at the relaxation. The overall findings show mixed experience for both methods of pain relief. Some women who used the non-drug method reported that they were less effective than anticipated. The other question is, can children and adolescents benefit from relaxation technique? Okay, some relaxation technique may help children and adolescents with pain and anxiety and depression, headaches, or difficult with a needle-related procedure. But much of the supporting research will relate as a low quality. So we don't have a completely clear picture yet of the possible benefit. Okay. For the preparation demonstration for this technique, I try to show the demonstration of the technique. The following are step-by-step example of the relaxation technique that can be relayed to the patient by the health professionals. It is helpful to know a variety of relaxation techniques to offer to the patient, as different strategies work for different patients. Relaxation techniques have been shown to reduce cortisol level in patients, leading to decrease in a somatic and subjective experience of the stress. Like all beneficial, healthy activities, such as relaxation techniques should be practiced over time and implemented regularly for the optimal stress reduction. The technique like box breathing, while there are many different forms of a deep breathing exercise, box breathing can be particularly helpful with relaxation. Box breathing is a breathing exercise to assist patients with stress management and can be implemented before, during, and or after stressful experience. Box breathing uses four simple steps. Its title is intended to help the patient visualize a box with 4 equal sides as they perform the exercise. This exercise can be implemented in a variety of circumstances and does not require a calm environment to be effective. Step 1. Breathe in through the nose for a count of 4. You can try practice this step. Step 2. Hold breathe for a count of 4. Okay. Hold. Okay. Step 3. Breathe out for a count of 4. Step 4. Hold. Breathe for a count of 4. You can repeat. As a note, the length of the step can be adjusted to accommodate the individual. Example, just 2 seconds you can hold, or you can take a breathing just to 2 seconds compared with 4 seconds for each step. For the technique or demonstration of the guidance imagery, guidance imagery is a relaxation exercise intended to assist patient with visualization a calming environment. Visualization of a tranquil setting assists patient with managing stress via distraction. For instructive thought, cognitive behavioral theory suggests that emotions are derived from the thought. Therefore, if instructive thought can be managed, the emotional consequence is more manageable. Immediately employ all the 5 senses to create a deeper sense of relaxation. Guided imagery can be practiced individual or with the support of a narrator. Step 1. Sit or lie down comfortably. Ideally, the space will have a minimal distraction. Step 2. visualize a relaxation environment by either recalling one from memory or creating one through the imagination. Example, a day at the beach. Elicit elements of the environment using the each of the 5 senses using the following prompt. What are you see? Example, the blue color of the water. Second, what do you hear? A wave crashing along the shore. Third, what do you smell? Example, fruity aromas from the sunscreens. What do you taste? Example, salty sea air. And what do you feel? Example, warmth of the sun. Step 3, sustain the visualization as long as needed or able. It means focusing on taking slow, deep breathing throughout the exercise. Focus on the feeling of calm associated with being in a relaxing environment. The other ways of progressive muscle relaxation, we can demonstrate a little bit. Progressive muscle relaxation (PMR) is a relaxation technique targeting the symptom of attention associated with anxiety. The exercise involves tense and releasing muscle, progressing throughout the bodies with the focus on the release of the muscle as the relaxation pace. Progressive muscle relaxation can be practiced individually or with the support of the narrator. Step 1. Sit or lie down comfortably, either in the space with a minimal distraction. Step 2. Starting at the feet, curls the toes under and tense the muscle in the foot. Hold for 5 seconds, then slowly release for 10 seconds. During the release, focus attention of elevation of attention and the experience of the relaxation. Step 3. Tense the muscle in the lower leg. Hold the 5 seconds, then slowly release for 10 seconds. During the release, focus attention on the elevation of the tension and the experience of the relaxation. Step 4. Tense the muscle in the hips of the buttocks. Hold for 5 seconds, then slowly release for 10 seconds. During the release, focus attention to the elevation or tension and the experience of relaxation. Step 5. Tense the muscle in the stomach and chest. Hold for 5 seconds, then slowly release for 10 seconds. During the release, focus attention on the elevation of the tense and the experience of relaxation. Step 6. Tense the muscle in the shoulders. Hold for 5 seconds, then slowly release for 10 seconds. During the release, focus attention on the elevation of attention and the experience of relaxation. Step 7. Tense the muscle in the face. Example, squeezing the eye shut. Hold for 5 seconds, then slowly release for 10 seconds. During the release, focus attention on the elevation or attention at the experience or relaxation. Step 8. Tense the muscle in the hand, creating a fist. Hold for 5 seconds, then slowly release for 10 seconds. During the release, focus attention on the elevation of the tension and the experience of relaxation. As a note, so be careful not to tense to the point of a physical pain, and be mindful to take slow, deep breath throughout the exercise. Okay, as a clinical significance for the relaxation strategies are used as a therapeutic intervention for the patient experience stress. It's a widely accepted that high stress, particularly sustained rate of high stress, have negative effect on physical and mental health. Chronic stress in childhood and adulthood can lead to increased blood pressure and mental health issues, among other health concerns. Additionally, chronic stress has been shown to affect brain development, specifically the amygdala, which is essential for the emotional regulation, and the prefrontal cortex, which is necessary for executive functioning and decision making. Therefore, this is useful to have a relaxation strategy as coping tool to share with patients to decrease the stress. Enhance healthcare team outcome. The healthcare profession is stressful for the physician, nurse, and pharmacy and other related professions. Burnout from the stress is common. There's many types of relaxation techniques have been developed to help ease the tension and relieve the stress. There is a literature to show that stress-free individuals are more efficient and effective compared to stressed individuals.